Hello, everyone. My name is Dr. Richard Horowitz, and I am the co-host of the Doctor Talk Healing Lyme Summit 2.0. It is my great pleasure today to introduce to you 8 individuals who have done Dapsone combination therapy, and a doctor who's also joining us who's used Dapsone combination therapy in his patients. And you're going to hear today's stories of healing and hope. The individuals on the line today, you're going to hear from them. What were they diagnosed before they came in today? When they came to see me in my medical office, did they have chronic fatigue syndrome, fibromyalgia? Some of the patients you'll hear were diagnosed with autoimmune diseases like MS, rheumatoid arthritis, or lupus. They were told sometimes it's in their head and they just had a psychiatric condition. So I'd like to share with you today the power of Dapsone combination therapy and the MSIDS model. Because a lot of people are asking themselves, what exactly is chronic Lyme disease? Why do people stay ill? Why am I still having chronic fatigue and these aches and pains that migrate all over my body? Why do I have neuropathy, these tingling, numbness, burning, stabbing sensations that don't go away, or memory, concentration problems? I can't fall asleep. I have these mood disorders with depression, anxiety, or I'm hearing things. Is there an answer? And the answer is yes. Dapsone combination therapy. I discovered this therapy years ago when Johns Hopkins researchers and researchers from other universities discovered that Lyme disease, as well as Bartonella, are what are called biofilm persister bacteria. And this means that these bacteria hide under biofilms and go dormant. Up until then, we were using standard medications for Lyme, and when we would stop them, the symptoms would oftentimes come back in the vast majority of people. We are now seeing great success with Dapsone combination therapy and also addressing the 16-point MSIDS factors that are keeping people ill. So what exactly is MSIDS? MSIDS is multiple systemic infectious disease syndrome. This is a model that I developed over the last 40 years of seeing over 13,000 chronically ill people. And what it is that there are 6 factors driving inflammation. There are the 3 Bs, Borrelia, Babesia, and Bartonella, and other tick-borne infections. But there are sometimes viruses that reactivate, like Epstein-Barr virus. There might be fungal infections in the gut, like Candida, or parasites like Babesia. And then people have problems with environmental toxins. Many of our patients now are testing positive for mold, as you'll hear today. Some of them have had heavy metals like mercury in the blood. Or they have microbiome issues. They have leaky gut with food sensitivities, mast cell activation, difficulty sleeping with severe insomnia, as well as vitamin and mineral deficiencies. It's like going into a doctor's office with 16 nails in your foot and telling the doctor you have pain, and the doctor only finds 1 nail. So once we address these 6 primary factors of inflammation and the 10 downstream effects of inflammation, which include mitochondrial dysfunction, POTS dysautonomia with low blood pressure, hormonal disorders, for example, adrenal insufficiency, or men with low testosterone, having people have liver dysfunction. They're too tired and they're deconditioned. They can't get out of bed. We're finding all of these overlapping factors with neuropsychiatric conditions affecting these patients. And the good news is, once we use these biofilm persister drug regimens, like Dapsone combination therapy, and address all of the factors on the MSIDS model, people do get better. So now we're going to start with our first person. I'm going to bring on Nikki. Would you please come on and tell people your story? There we are. Nikki,
Hi.
good to see you.
Good to see you, Dr. Horowitz.
Great.
I'm Nikki. The Dapsone protocol has given me my life back, but it wasn't always that way. I started having symptoms and got sick in 2017 and was lucky enough to get diagnosed in August of 2018. At the time, I was diagnosed with Lyme, Babesia, and Bartonella. My symptoms included a lot of neurological manifestations. I had extreme fatigue, neuropathy, joint pain, cognitive difficulties, just to name a handful of symptoms. I was sleeping, 16, 18 hours a day. I couldn't get out of bed. I barely made it through my senior year of high school and then took 3 years off from college. Lyme disease, as well as the other factors, robbed me of my life for many years. I spent, years on the couch as my peers and siblings continued, living their lives. Prior to seeing Dr. Horowitz, I saw a few other doctors, including some other Lyme doctors, and I did basically all the other treatments in the book. I did IV antibiotics, oral antibiotics, herbs, disulfiram for about 8 months. I really tried everything, but I would find that as soon as I stopped the other treatments, my symptoms would come back. And then when I first met with Dr. Horowitz, I met with Dr. Horowitz in 2022. And when I first met with him, we identified the other MSIDS factors. We concluded that I had POTS, mold toxicity, and severe adrenal dysfunction. And then after addressing all these other issues, I then did the Dapsone therapy. So with the Dapsone, I remember when I started the Dapsone, actually, we started off on a very low dose and we, built up on it. And I even did remember the low dose at altitude in Colorado, and I had no adverse effects or met hemoglobinemia. Overall, I tolerated the drug really well. I was, anxious because of the side effects, but I really didn't have any issues or adverse effects from the Dapsone, just the herxes. And I did double dose Dapsone and then a few pulses of the quad Dapsone. I think what was really keeping me sick was the Bartonella, and I think that was the most difficult to treat. But I found that the quad Dapsone really helped me get through that and helped me heal from the Bartonella. The treatment is really difficult. When people ask me, I don't lie. I say it is intense. And it's hard, but it's also so worth it. And I found after years of all these other treatments, the Dapsone therapy is for such a short amount of time, so it, it's not easy, but it's not too long. Also, as I experienced each time I did another round of Dapsone, it got easier and easier because my herxes were less and less because each time the bacterial load was lower. And I was at a point where I never knew if I would fully return to complete health. When I was really sick and would think about what life would be like if I ever got better, I never imagined that it would be as great as it is today. And I never knew I would be able to feel this good again. So I'm filled with immense gratitude for Dr. Horowitz and the Dapsone therapy because it really gave me my life back. That's my story. Thank you, Dr. H.
Thank you. That's a wonderful story, Nikki. Really appreciate you sharing it with people. The next person who's going to come on is going to be Jerry. Jerry, would you please come on and tell people your story?
Yes, hello, Dr. Horowitz. I've been a patient of Dr. Horowitz since 1994 when ticks infested our yard. And since I'm an outdoors guy and kind of a tick magnet, I've been suffering from Lyme and associated diseases since 94. Lately, when Dr. Horowitz came up with the Dapsone, my ears came right up and said, let's try this. So previously, with 2-3 months of antibiotics, after a while you say, yep, I'm all 100%. I'm good. I don't need any more antibiotics. But I went and tried this double Dapsone protocol 8 weeks this summer. I was diagnosed by IGeneX Labs, which again, kudos to Dr. Horowitz, who started using IGeneX early on as one of the most qualified labs for identifying Lyme disease. And then I came down with Lyme this summer with 3 other diseases, Bartonella, Babesia, and one that came from the West Coast, and I think it's TXRF or something like that, but I got it. So I did the 8 weeks, and again, the protocol is not easy to take. I would build a week's supply worth of pills, which is about 25 in the morning and 25 in the evening. And that way, all I had to do during the day was take those pills and get them down. Then through the recovery, I realized that all the symptoms I had, the headaches, the back pain, the cramping of muscles, the abdominal pain, the rash that I had on my chest and stomach that wouldn't go away even with steroid cream. All of these things just disappeared. And in the recovery phase at the week 3, I realized that when I was always asked, what percentage are you of normal again? That all those times I said 80, 90, 100%, you can take 50% off of those because this double Dapsone has made me feel just 100%, a great feeling. Now, one of the things I want to say to anybody that takes it on is when you ramp up the Dapsone from the 25 milligrams up to the 200 milligrams a day, you come across times where you think you can't breathe and maybe your breathing is shallow, but then it comes and take a deep breath and that feeling just dissipates entirely. And so far I've been clean and clear of any of those symptoms and feeling great. And I feel like I've got my life back because I do enjoy the outdoors. I enjoy my gardening. I enjoy my dogs, my cats, and I enjoy golf still. So, um, thank you, Dr. Horowitz. That's my story, and kudos to you. Thank you.
Thank you, Jerry. That's a great story. Really appreciate your sharing. The next person who's going to come on will be Michelle. Please come on and tell people your story.
Hello, Dr. Horowitz, and hello, friends. I really appreciate this platform to share my story. So I had Lyme disease for nearly almost half my life, mid-30s now, had it for 15 years, and then finally saw two Lyme doctors, mainly on the West Coast. Tried different treatments, but unfortunately we didn't cover the rest of the co-infection. So 2020, I became a patient of Dr. Horowitz's. I had COVID, actually, and he was one of the few Lyme medical doctors actually that knew how to treat COVID. So was doing the glutathione, heavy supplements, while also really getting to the root issue of the Lyme disease and realized that we had 6 other co-infections. So for 3 years, I was a patient, literally trying trial and error of different antibiotics, different natural supplements, all the while also doing a lot of deep internal work. So a bit about my story. I got bit by a tick somewhere. I come from California, not your typical like New York audience, where you grow up with ticks nearby, but yeah, and also realized that I had a lot of trauma. So similar to some folks that maybe didn't have an easy upbringing, like survival of sexual assault, survival of high school bullying, survival of toxic workplaces, and like really bad like relationships. So a lot of trauma accruing over in the body and the mind. And finally in 2020, we decided that it was time to finally heal the body. So we tried quite a few different modalities, different treatments, and the silver bullet, I will say, where we actually started to see like huge success was with Dapsone. So we started double Dapsone protocol. That made some strides, but then, probably after 2 years, we started to see some improvements, right? So we decided to kick it up a notch. And if anyone knows anything about me, they know that I'm a go big or go home type of person. And so I'll say from my experience, there were 2 options, right? Like going into treatment. And Lord knows that I wanted to give up so many times, right? And the 2 options were I could give up and just stop and my life could be okay and I'll just be sick for maybe the rest of my life and it'll develop into more awful things and we'll still be sick. Or I can have something way more intense, try it, see what comes out of it, and then with the possibility of getting my life back. And so I really want to hammer in on like where I currently am right now. I've been in remission for 2 years. Thank you, Dr. H. I am now able to fluently speak Mandarin, Hebrew, Russian, probably about like 6 other languages for my work. I'm also back into engineering. I'm a surfer again. I travel all over the world and I surf. And I also do dance. I'm a Zumba instructor. Like my life is back not only 100%, but like 110. So I just really want to tell people that if the hope gets down or if the treatment gets so bad, what was really important for me was visualizing how it would look, how it would feel, how it would taste, how it would smell of actually being healed. And there are some, neuroplasticity programs that can maybe help. But again, the double Dapsone, or in my case, the quad Dapsone, like that was the silver bullet, along with some trauma therapy, along with a really good support network that will never leave your side no matter how hard it gets. And then Dr. H's support. And yeah, so I love my life now. And I really just hope that this story inspires other people. Again, no matter how hard it gets. I was in the hospital a couple of times for, some other like side effects and whatnot, and I made it through. But like there are so many times where you feel like you want to give up. Don't. Like just please don't. Like just keep going. Know that there's hope, and I hope these stories from all of the other folks on this call will inspire you to really keep going because you can have your life back and it can be 110% better than it was even before. So I hope this gives you hope as well. It's not easy, but if it was easy, then everyone would be doing it. And so I'm sending you all so much love and hope. Thank you. That's my story, Dr. H. Back to you.
Right. Thank you so much. That is just a great story. I know how sick you were from before, and boy, that's really amazing. So thank you for sharing. That was great. The next person who's going to share their story will be Todd.
Thanks, Dr. Horowitz. I really appreciate the chance to talk. I had Babesia and Bartonella and undiagnosed for probably 12 years or so, and I had tons of tests done and all kinds of things done because I have shortness of breath, I had chills, I had balance issues, I had tingling in my fingertips, and no doctor was able to discover anything until I found finally a Lyme doctor who was able to treat the Babesia with Mepron and then ultimately with Malarone, and that helped a little bit. But I was in such a situation that I couldn't. I'm a university professor and I tend to walk around a lot when I'm teaching, and I couldn't even. I had to have a chair to sit in to even get through the hour and a half of class. So I was in really pretty dire straits, and I had a series of pneumonias that I think was a result of my weakened immune system from primarily, I think, Babesia, but also Bartonella too. And then I got into Dr. Horowitz's practice, thanks to God and to him, and uh, and I and it was and initially there were things that I did like disulfiram that really helped, and they made things better, but I then did a double Dapsone protocol that made a giant stride forward, but I was having periodic chills, especially when I would exercise, and I come up the stairs, I have a little shortness of breath, and I still had balance issues. So I was working with John Fallon, Dr. Horowitz's PA, and we decided let's do a quadruple Dapsone protocol, and that I did that a year and a half ago, and since then so it took me that was in I do have to reiterate what some people have said, that was incredibly hard to get through, and the thing that kept me going through it was the idea that this may be the thing that gets rid of my symptoms totally, which it was. So I haven't, for the last year and a half, I've felt just basically nothing. Like I feel totally fine. And a lot of my other bodily issues have totally cleared up just because I think my immune system's gotten back in shape. And so that was really, it was just that quadruple Dapsone was again hard, but like so incredibly worth it. And I thought it's just like a miracle, and I really appreciate it. So that's my story. And again, thank you so much, Dr. Horowitz.
Oh, it's my pleasure. Thank you so much there, Todd. The thing is also is when your story with the shortness of breath, it was Babesia, you were fish positive times 3, and ultimately it did get better. So it's a great story to know that even quad Dapsone helps. The next person who's going to come on is Laura. Please come on and tell your story.
Hi, Dr. H.
Hi there, Laura.
Hi. So I was sick as a kid with a Bartonella and had a lot of strange symptoms and, wasn't sure at the time, didn't know what it was. In 2007, when I was in my 20s, right after I finished dental school, moved to New York City, and I had a tick bite. I didn't know it was a tick bite. I was diagnosed as having MRSA and treated with inappropriate antibiotics. So over the next 10 years until I was properly diagnosed, I was misdiagnosed with rheumatoid arthritis, and I was immunosuppressed. I had migraines. I had horrible joint pain. That was my primary symptom. Neck stiffness. Being a dentist, I thought that a lot of these issues I was having were from my profession, but I had just started working, so it didn't really line up. I had emotional dysregulation. I had immune deficiency, and obviously I was being immunosuppressed, so that made everything worse. I saw countless doctors, specialists. I was living on pain medicine, and I was like, this is not a lifestyle. So I finally was diagnosed properly, and over the next 10 years saw countless doctors, LLMDs, who gave me rounds of antibiotic combinations and IV antibiotics. And then they basically just said, well, you must be better. It must all be in your head that you're still sick. Finally, I got in with Dr. Horowitz less than a year ago, and I've completed the Dapsone protocol and 4 pulses of the quad Dapsone. I started at probably 20% of normal, and I was pushing through with the use of a lot of caffeine and things like that, and adrenally fatigued, and getting through the pain and the migraines and just kind of pushing through. Now, less than a year later, I'm at easily 70 to 80% of normal. I work out almost every day. I'm back to work. I'm not in pain at all, which is a miracle. I don't get migraines. So it's very strange to see what life is like when you've been in pain for so long. When it's not there, it's almost like this ghost that's just like, you're waiting for it to come back and it just doesn't come back. And it's pretty cool. So I would second that, you know, now I'm getting 15,000 steps a day easily, with no issues. I'm not short of breath. I did a Babesia protocol that worked really well for me. I'm sleeping great. Not getting issues with like panic and anxiety. So I would say at this stage, you know, you get through this, and for me, it was like, this is my last chance. I've been to the clinics. I've had every treatment out there. I've done ozone. I've done everything. This is my last chance. So I followed the protocol to a T. It was my full-time job. And I remember getting my box of supplements for the first time and being so excited because I was like, finally, like I was like a kid in a candy store. I was like, finally, like someone else is in charge. I don't have to be in charge of this anymore. Like this is not for me to decide and to be treating. So I feel so grateful that I was able to get in with Dr. Horowitz. And I think now is the time where you heal the emotional side of things and you heal your nervous system. And I'm doing the Gupta program and I meditate twice a day. And you're sort of healing your brain and your system from being afraid of everything, and afraid of your own body. And so you rebuild your relationships with yourself, with your friends, with your family, with everything that, you know, these infections kind of took from you, but it's temporary. So thank you for letting me be a part of this. That's
Oh, my pleasure. And you still have to detox the mold, right? We still got some mold and mercury left, don't we?
Metals, I do. I was lucky. I mean, I used to sauna every day and I was taking a ton of glutathione before I saw Dr. Horowitz. So I was injecting glutathione, I was doing patches, and I was sauning every day. So luckily, I used to have horrible mold. I did not have mold going into it. I was very lucky. But the metals, yeah, we have a couple like cleanup things, but it's pretty awesome.
Yeah. Well, thank you, Laura. That's a great story. I'm so happy. I mean, you've been sick almost your whole life. So basically, to have your life back at this point with a year of therapy with these 4 quad Dapsone, and again, not easy, but worth it. I mean, people do get their life back and it's solid, right? I mean, you're moving forward. So I'm so happy for you.
Thank you.
Yeah. Thank you so much. Our next person who's going to share their story is Reggie. Reggie, why don't you come on and tell your story?
Hi, my name is Reggie Manning, and I'm 61 years old now. When I was in my early 40s, for like out of the blue, I started to feel lethargic. I never got any restorative sleep. I started to gain weight, and I just couldn't figure out what it was. I never had a bullseye. No one had ever mentioned anything about a tick to me. I went to see many doctors. Finally, I was diagnosed with hypothyroidism and put on Synthroid, and that helped me for about 18 months. And then all the symptoms started to come back again. And then I was diagnosed with heavy metal toxicity and food sensitivities. And this went on for about a decade, until I finally was diagnosed with Lyme, Babesia, and Bartonella. And at that time, I would say I was running at 35%. It was really, really tough. A lot of doctors told me, hey, you're getting to be middle-aged. This is what it's like to be a woman in your 40s. And it just didn't make sense to me. Every time I would be put on an antibiotic for a few months, I would feel better. Then as soon as I went off the antibiotic, I felt terrible. I had joint pain. I felt like someone was snapping rubber bands at the bottom of my feet. I was short of breath. Was still not getting any restorative sleep. I had I had felt an unbearable anxiety, which I had never been anxious before. And I just couldn't get a handle on it. And so I went to see many, many doctors. I would say I probably saw a dozen doctors. Out of that, maybe 5 had some treatments for me, but nothing lasted. And then I happened on Dr. Horowitz's first book, Why Can't I Feel Better? And all of a sudden I felt like, okay, someone is talking to me. And so in 2016, I went to see Dr. H, and I was put on the Dapsone therapy. And it was hard, but it was, like many people have said, I was so relieved to finally have a quarterback for what I was going through, and that I didn't have to make the decisions. And so I did that for however many weeks, and slowly I started to regain my health back. And I would say that I'm at, 100, 110% after losing a decade of my life. And it's been unbelievably miraculous, because looking back then, I think one thing about having Lyme or these tick infections is that it's not like breaking your arm or another type of illness that people can relate to. If you kind of push yourself and show up to work and drive your kids to school, everyone thinks you're fine, but inside it feels like you're dying a slow death. And so for me, this has been absolutely, the Dapsone has been life-saving. And I'm so grateful to Dr. Horowitz, and so appreciate you putting this out so people could see that there is hope. And it sometimes feels hopeless, but no, if you push through it and do the Dapsone, you will find that you'll regain your life and it'll be amazing again. That's my story. Thank you, Dr. H.
Yeah, thank you, Reggie. You did the Dapsone at about the time that my wife did. You're right. You were one of the earliest people.
Yes.
Just doing. My wife is going on 6 years in remission at this point, and so you're several years in remission also from it, which means your BART wasn't active, because, as you heard earlier, the people with active BART, they usually need the pulses. But that's fabulous that you're still so
Yes.
well years later.
It's amazing. Thank you.
Yeah, thank you so much for sharing. Our next speaker is going to be a doctor. Dr. Alan Moss, he's taken one of my training courses to learn how to do Dapsone combination therapy. And I wanted to bring Alain on to tell people a little bit about his experience with using Dapsone for his patients, so people could hear your success stories.
Hi, yes, I'm the first physician today. I would like to say that I have the privilege to follow the training of Dr. Horowitz since 2016. The amplitude of the phenomenon in my office is that I've just got the 71st Babesia patient. More than 90% of my IgNX tests come back positive, not for the same bacteria. I would like to share with you that 2 or 3 cases. I will try to be quick, because as a physician, it's not my own story, and I would like to share what I witnessed. I will tell you first what a mother wrote to me. The mother states almost miraculous improvement. He has been sick since the age of 8. Sean is 22 years old. He had diarrhea in the morning for years and would eat only at noon. He was not able to eat in the morning for at least 4 years. The GI doctor suggested a feeding tube. For years, he was nauseous and felt full, losing weight. In 4 weeks of Dapsone, he is able to eat. Now he interacts with the family, which he has not done for years. He has more energy. The mother stated that she thought she lost him for years, and that now a son is back. The fatigues that started years ago start to improve with the Lyme treatment, improve with Dapsone. The mood is much better, 8 out of 10 now. From depressed and suicidal before, it's now optimistic. His stamina is better. It goes to the climbing gym 3 times a week. But the fact is that he got 10 fractures in the past, 18 torn ligaments, and 13 concussion for minor trauma. Today, he is able to exert himself to climb without any trauma. The mother stated that he did not have a childhood, now he is back to life. The second patient is a 31 old man patient who was diagnosed with bipolar disorder. He came with a diagnosis with psychiatric medication. But when we ask a question, aside from the psychiatric disorder, he has brain fog, confusion, memory impairment, fatigue. He has muscle pain, migratory numbness. The classic presentation of Lyme disease, of course, with IgNX, he he tested positive for Babesia, Bartonella, and Lyme. For about almost 1 year, I tried to treat Babesia, to treat Lyme, Bartonella with antibiotic, with herbs, and it got improved, but back and forth, up and down. It did not go, it improved, but not that well, to the point that is an accountant, is too tired, difficulty focusing, that the boss forced him to be on disability leave temporarily with a vague promise to take him back. But we are not really naive. His job was really a threat. He's a young man, he's married, he has children, and the livelihood was really a threat. So I said to him, look, we have to really to treat, and to treat more aggressively, because not only your life may in your professional life, your self-esteem, and all what it comes with, it's a threat. So we decided to do a Dapsone protocol. With a Dapsone protocol, it get in about 3 weeks 90% better. His mood came back, his panic attack gone, headache almost gone. We had some methemoglobinemia problems that was resolved very easily by increasing methylene blue. I went up to 600 milligrams of methylene blue with him, and that was really wonderful. And he got his job back. And I think the message that I want to say that Lyme can destroy people not only physically, emotionally, but also professionally, and to be able to give to patients their dignity, their functionality, someone who was about to accept a state of a disability, and for how long. This person now is back to work. I would like also to mention this 600 milligrams of methylene blue makes me think of the Bartonella protocol that Dr. Horowitz taught me. And I applied that no long ago, and then it's very striking, because I had a boy that also Babesia, and I dragged him for 1 year up and down. And finally, we decided to do the Bartonella protocol. In 1 week, I saw the patient back to my office, and I stayed totally stunned. The patient who used to be like a shy teenager who did not find a place in the seat, not comfortable, not facing me the gaze was very poor. Now I see a boy who comes with confidence, like a mature boy. I looked at him and I shook his hand. I said, I cannot understand such a change in 1 week. Mother tells me that teachers are totally shocked by the change of the attitude. From the most lazy boy of his class, he is the most motivated. He wants to go to school even when the school is off. He has ambition. He wants to learn. He wants to. When I saw him 1 year ago, he was home. He was in homeschooling. The last patient that I saw was a patient about 17 years old, who very nice parents, but the boys behave like with no manners. He slams the door when he leaves the exam room, disrespectful, no boundaries, no social boundaries. He got kicked out of how many schools. In 1 week of Bartonella protocol, he had a herx, and the parents were a little bit not so happy, but I explained to them that is a herxheimer, and I treated the herx. And a few days after, I got a phone call from the mother to speak of a miracle. He behaved so nicely. Even the sister mentioned that he can talk with him. Teacher said that he can have a conversation with him. This is within a week. And this is what I would like to say, that the Dapsone protocol is absolutely amazing. From a physician perspective, I would tell you that I cannot barely believe what I hear, what I see. Thank you, Dr. Horowitz.
Thank you, Alain. That was really wonderful. I appreciate you sharing those stories. Wonderful.
Well,
And the last people who are going to join us, really also wonderful stories, is Jen and Ben. So Jen, please come on the line and tell us your story, which is really an amazing one.
Hello. Hi, everybody. I just wanted to say thank you for the opportunity to come on and speak to everybody about the Dapsone protocol and about our experience. I'll be speaking today first about myself, and then next about my son, Ben, who was 10 at the time that he did the Dapsone protocol. I think my story, like a lot of people's, is too complex to crush down into just a few minutes. Basically, before I became sick, I grew up in rural America, tons of outdoor time. I was a very functional human being. I could organize quickly. I thought quickly. I became the first person from my school to go to an Ivy League school for college, went on to medical school. Life was going swimmingly. And then I got sick. And because of a delay in diagnosis over the course of nearly a decade, by the time I was diagnosed in 2022, I basically looked like someone who was suffering from dementia. I would get lost on the road. To get to the Lyme doctor that was eventually the first person to treat me, I got lost going there. I couldn't figure out how to fill out the forms because I couldn't really read. At that point, he had to sit down with me and some staff and read the forms to me. And he asked me, how would you describe your day-to-day life? And I said, I almost burned down the house more times than I can count because I would put things on the stove and I would forget. I would have to set reminders to pick up my kids from school. And I basically lived in a state of wanting to sleep, sleeping, taking a hot bath to try to ease some of the pain, or wishing I could get to sleep. And that was every day. I had a list of diagnoses almost as long as my arm at that point, including ankylosing spondylitis, fibromyalgia, migraines. The list went on and on, with back pain being one of the most prominent. Because I was a doctor and because I grew up on the Eastern Shore where I had encountered many people with Lyme disease, I asked for Lyme testing not once but twice. The second time was with a rheumatologist. It was negative, and he told me, don't worry about Lyme, put that out of your mind. That was in 2019. And after that, I didn't really think about it as I got sicker and sicker and sicker. In the end, I had seen about 36 different providers for the different symptoms that I was having. 4 of those were rheumatologists. And no one ever meant or thought of Lyme. Even when I would bring it up, it was shut down. It was finally my 5th physical therapist since all this started. And she was going through things with me and she said, you should really see a functional med doctor. Maybe there's something else going on. And so I went there, was promptly diagnosed with Babesia, Bartonella, and Lyme, and then went on to see my first Lyme provider. That was about 9 years after I first started having symptoms. I was with him for 9 months. This is a very well-respected, very established physician in the Lyme community. I was put on an increasing cocktail of drugs, and most things would get better. Some things got worse. I was never symptom-free, and I was very concerned that I would have a relapse once things were stopped. Sure enough, I started to get increasing side effects from the medicines. Things were stopped, and my symptoms rapidly came back. And that's when I came up to see Dr. Horowitz. I had done the physician training through the online multi-day seminar, and I realized that it probably wasn't going to get better on what I was on, and that there were a lot of other things that hadn't been addressed. And once we started addressing those other MSIDS criteria, I had undiagnosed celiac with a lot of vitamin and nutritional deficiencies. I had leaky gut, I had POTS, I had MCAS, I had, of course, the autoimmune reactions, and what turned out in the end to be a very severe mold exposure. And once we started addressing some of those things, including in my case, starting low-dose Dapsone, I was, as opposed to the other speaker who was excited to get her box of meds, I was completely overwhelmed because I couldn't think or function enough to even attempt the protocol. It took about 4 months of starting a little bit of Dapsone just to be able to think enough to take the medicines. And then once I started, it was like somebody just turned a light bulb on. About week 5, I was completely asymptomatic at that point. I did infrared sauna to help with the body aches. I did have some pretty severe headaches, which did get better with some adjustments to my medication. And week 9 was rough. Like most other people described, that one was not easy for me. I felt really short of breath and really fatigued. And so that was probably the hard week for me. But aside from that, I went from 15% of normal to probably 95% of normal. I have not done a pulse yet because I am not alone in this. Both of my children were congenital infections. And so as soon as I got better, we transferred the children into Dr. Horowitz and John's practice to help them get better. And that's where we are right now. And I have a little man in front of me. Come over and say hi, Ben. So Ben's going to just say hi, and then I'll go through since he's here right now. You want to come over and say hi? Come on over. Hi. Drop your head and say hi.
Hi, Ben.
Hi. Here's
Good to
Ben.
see you, Ben. You look great.
Ben, and how old were you when you started? Do you remember? I think you were 10, right? You want to say hi? Okay. And then come down.
Hi.
And how would you describe how you feel right now? Better. And what did you do yesterday?
Basketball.
And how many points did you score?
10.
10. How many rebounds?
15.
15. Yeah. And do you want to say anything else to anybody that's thinking about this? Was it easy or hard? Hard. Would you recommend people do it if they can try?
Yes.
Yes. All right. So I'll describe Ben's case a little bit. Okay, you want to go back up? You can't control kids, right? So
He's adorable, Jen.
so that's Ben. So kiss. So my son was likely a congenital infection with Lyme based on my symptoms during pregnancy. And then his symptoms when he was first born, I think it's pretty safe to say that he was a congenital exposure. And on top of that, going through some things early in life, he was bit by a tick, which resulted in very clear early disseminated Lyme when he was 4 years old. And from that moment on, things really got worse. Because he's a child, I'm not going to go into his medical history like I would mine, but suffice it to say, he was extremely fatigued. Most of the time, the eczema would come and go, increasingly worse. He had a lot of problems with pneumonia, throat infections, asthma, a lot of things that people could not explain. He had seen, by the time he was diagnosed, 14 specialists, in addition to the pediatricians in his office. I looked up from the time when he had the definite bite when he was 4 until the time when he got the Lyme diagnosis. He was seen 27 times there, mostly for throat infections that would just never grow out anything, but would sometimes sort of respond to antibiotics that he was given. At that point, when he was getting very sick, his behavioral issues were becoming more prominent too. There had been some concern for autism, but with people more familiar with the autism spectrum, he never looked quite right for them. We did go ahead and get a neuropsychiatric profile done, and at that point, the behavioral pediatrician that we saw actually said, "Hey, this is what Lyme looks like. You should consider Lyme." And I said, "Hey, that's funny because they just told me I had Lyme." And I was so confused at that point. It still took me a while to connect the dots. But we shortly thereafter got them tested. Ben was positive for Bartonella, Babesia, and Lyme as well. He was having symptoms before the diagnosis. And once he started on the doxycycline that they initially gave him, his symptoms worsened, and the herxes were the worst thing I've ever seen. He was bedbound. And then it just started this vicious cycle where we would try to treat him with antibiotics, and the inflammatory response we would get was so strong that he would usually end up bedbound again. He missed, I believe, possibly 70 days of school in one calendar school year because of the amount of pain and inflammation he was going through. At times when we decided, hey, this is too much, let's just stop. then he would still be having symptoms from the underlying infections that would result in us still needing to go and seek medical care, and then still taking other drugs because of the issues that were coming out. So at a certain point, after we tried 3 other Lyme providers, I had experienced success with Dr. Horowitz's group, and John was willing to take him on as a patient. So we came up there. I would say at this point, his quality of life was very low. You know, he was mostly in a wheelchair. The fatigue that he experienced was pretty severe. He was having a lot of shortness of breath. He was having, life was not very enjoyable for him at that point, let's put it that way. And John looked at him, very compassionate, put together all of the pieces that we'd been missing, figured out how to get him to detox better, and started him on the protocol. He went 7 weeks, and because he's a child, he was hiding some of his pills, and that caused him to get anemic. And so we had to stop at 7 weeks. But he went from, I would say, probably 10-15% of functional to 80+% of functional. Seemed pretty good. He tried to play sports in the fall, and that's when his spine started to bother him quite a bit. So we said, hey, let's try the pulse. He couldn't do the pulse. He did the first week, but the second week with the quad, it was just too much. He was, 10, just turned 11 at that point, I think. And he wasn't able to do the second week. Even considering now compared to how he was before, it's a miracle. He's making nearly straight A's in school. I believe he's missed, like, aside from when we did do the pulse in the beginning of the school year, I think he's only missed 2 or 3 days total. He doesn't really get sick anymore. He has tons of friends and is very social. He's on his basketball team, and played a full game last week, which, considering that he was in a wheelchair last winter, I think that's amazing. Anyway, so we're both very grateful to Dr. Horowitz and for the Dapsone protocol, and to people out there dealing with this in themselves and in their children. I think it's really important that even when things can seem really, really bad, that this was life-changing. It worked not only so well, but so quickly. And also, considering how much money we've spent on Lyme treatment, it was so relatively inexpensive as well. And I think the risks, which are definitely out there, are definitely outweighed by the benefits that we've seen. So I just wanted to say thank you very much from the bottom of my heart. I appreciate getting my life back. I can not only read now, but I'm getting my medical license back to practice. And to continue the work that you've started. So thank you.
Oh, thank you, Jen. So, at this point, it's really amazing to listen to these stories of people. I think it's even great for me. It touches my heart, even though I know all of you, to hear your stories directly, right, independently from my seeing you in the office and doing this. It's a wonderful thing for me, because I never actually thought that years ago I would be discovering an answer for Lyme, much less for Bartonella. I mean, we're in the middle of a full epidemic. And I think what people have heard today from you, as they've heard from the last Dapsone documentary we did, is there really is hope for people. This is a short-term protocol. As you heard from people, it is not easy. I tell patients this is like cancer chemotherapy. It will put you through some difficult times, but when you come out the other side, you will be better, and it applies to almost everyone. But you heard it's not just Lyme. It is Babesia. It is Bartonella. It is mold. It is Candida. It is heavy metals. It is leaky gut with food sensitivities and mast cell disorders. It's neuropsychiatric issues. It's insomnia. It's vitamin mineral deficiencies, POTS dysautonomia. You have got to use the MSIDS model and biofilm persister drug regimens like Dapsone combination therapy, because as you heard from the people today, you're getting their lives back. And doctors who've taken the training course, like Dr. Moss, and Jen also had taken the training courses, which is how she knew about it. You're hearing from them directly that people are getting their lives back. So I want to thank everyone today who've come on the line and told your story. It really brings me great joy to hear these stories. It's the best thing for a doctor to know that you've been able to help someone's life and give their life back. And that's what Dapsone combination therapy and the MSIDS model has done. So thank you, everyone, for joining us today on the Doctor's Talk. My name is Dr. Richard Horowitz. I'm the co-host of the Talk Healing Lyme Summit 2.0. We hope to see you again for another episode soon. Thank you so much for joining us today.